Well, since the government took office, since the president um, was sworn in, one of his main priorities had been to look at the COVID situation. So we have started by looking at the various agencies that were tasked with the response under the previous administration. And as you would recall, they had different levels, the task force, they had a secretariat, they had the Ministry of Health responding on the medical issues, had the CDC doing something, you had other entities working. And what we found that it was also disjointed. And when I start asking for what are the plans, how you're doing, what you're doing, and so forth, I found different agencies had different plans. Nothing was in sync. They weren't coordinated. And so that's a major problem. So one of the things that we'll have to look at is how we bring a new structure that is more responsive to the pandemic and make sure that there's participation from various ministries and sectors who want to get involved with the response to the epidemic and the country as a whole. So that's a big task, but we found that the disjointedness and the lack of coordination would have been a major factor in terms of not being able to respond effectively. Secondly is that the ministry and the health, if I can deal with the health response, you would have noticed that there are hotspots now that has emerged in 9, 8, 7. We'll have to take some very concerted action to bring those under control. But one of the challenges that we have is that the previous government did not procure adequate amounts of test kits. So as it is right now, there's a limited amount of test kits that are available, and we have already started to address that. For us to know what is going on with the epidemic, we'll have to do more widespread testing. And so we have to build the capacity for PCR testing at the national level, and we are also looking at decentralizing some of that testing into the region. And why we need to decentralize is that it takes sometimes 8 days for somebody who tested positive or who had a swab done in Region 9, for that swab to get to Georgetown, then be tested at the reference lab, and the results get back to them. So if that person is positive, and you have a turnaround time of 9 days or 8 days or whatever it is, that's too long because that person would have walked around and be in contact with a lot more people and infect them. And so we have to change that. As it is, that is totally not acceptable. So one of the things that we'll have to do is change the turnaround time. On the other things, like capacity for testing, the machine that the National Reference Lab has is dated. When the PPP was in government, on the previous occasion, we had bought that machine for HIV. So it has been repurposed to do COVID. There's nothing wrong with that. But it takes about 5 to 6 hours to run those tests. So it takes a long time. The newer machines that are available on the market can do maybe about 96 tests in an hour. So we'll have to upgrade some of the machines that we have, the facilities that we have, so that we can run more tests and faster. One of the things that we are looking at, or one of the targets that we have in mind, is for the public sector to do at least, have the capacity to do at least 300 tests per day. And we want to collaborate. We have already engaged the private sector because they have PCR machines in their hospitals and so forth, to get them to be involved in this effort. And we are hopeful that we can get the private sector to increase their capacity to about 200. So as a country, we'll have at least 500 tests per day that can be done. So that's one thing in terms of building capacity. The other thing is that, as you would know, because I know you've been following the epidemic and what has been going on and so forth, is that the disease, the stages of the disease. So while these PCRs are used as diagnostic tests, there's also a role for the antibody tests. The ministry had had a position where they weren't allowing antibody tests, but in that limited role, one of the things that we are examining is to allow some of those tests to be utilized in that specific role. So that's something that we are also working on. We are looking at standardizing certain protocols and so forth. So from a medical standpoint, we have a number of things that we have already started working on to change. Now, we would have seen over the last, I think, week or so that a new hospital has been launched by the previous president. Well, what we have there is an absolute disaster because we have spent $1.6 billion and we literally have a shell. You have a building, there's no equipment, no bed. That building is supposed to house 197 beds. The beds, you got different types, the regular ones, the ICU, high dependency beds. For example, in the ICU, I think they were catering for about 20 adult beds, and they had another section for about 10 pediatric beds. But one of the requirements, a basic requirement of an ICU, is to ensure that you have centralized oxygen, suction, and those types of things. Now, you don't want to wheel in a 200-pound cylinder and put it next to the bedside, because every time you do that, the risk of infection and those things goes up in a unit like this. So the ideal is to make sure that these things are constructed and put into the walls, and you have outlet that come from the wall. That wasn't done. So we have refurbished this place and forget to put in all the essential things that are required for a proper ICU. So to utilize that building, we'll probably have to go and break those walls to install these kinds of pipes and outlets and so forth. So it's a lot of money, I would imagine, to go renovate. So I have a technical team that has started to look at some of those things, what we need to fix. We have spent $1.6 billion. Not a single piece of equipment is there. If you're going to treat COVID, severe COVID patients with complications and so forth, as you know, you need ventilators, you need a whole set of things. Nothing is there. So to buy those things, we have to buy them, put them in place. We'll have to buy the consumables. And those two, I'm trying to get a cost. Personal protection equipment, right? You got 3 levels. Every health worker working in a health facility should at least have some form of PPE, right? So whether you're at the primary care level, you should have a mask, you should have gloves. At the next, the maximum one would be at the ICU, where you have to get face shields or goggles, gowns, proper N95 masks, shoe covers, and all that. Sadly, these things are in very short supply. I've had complaints from the doctors at the Georgetown Hospital that they can't get N95 masks. So these are things that we'll have to rectify because we can't put the frontline workers at risk because these are the persons who are interfacing with the patient. So that's something that we'll have to work very quickly to ensure that we have enough PPE available. Consumables, area, reagents, it's another area. Medicines, that too, we have to make sure that we have adequate supplies of medicines. So there's a number of things that we have to do. The response that the previous government had engaged in is suboptimal, and I think because of suboptimal care, maybe a lot more people got sick, and we don't know the true magnitude of the epidemic and what is happening within the country. So we really have to revamp the response. We'll need more personnel. Imagine that place was open and there's no staffing plan for it. So let's assume that you had your 197 beds. There's no staff. right? Not a single nurse, no technician, no doctors. So I don't know how you're running a hospital without any staff. So all these people now, to operationalize that hospital, we'll have to get these people, we'll have to, make sure that they are in place, properly trained, and so forth. So we have a lot to do to operationalize that hospital, and I really can't understand where 1.6 billion Ghana dollars was spent on. But I guess the auditors and those other persons would have to take a deeper look.
So you have a headache on your hand. How are you going to deal with it?
I don't consider it as a headache because one of the things that I think we suffered from in the past is that the persons who were leading the Ministry of Public Health did not have the technical know-how to manage epidemics or pandemics, and therefore I guess they were not able to offer the kind of leadership. I think with the team that I'm going to put together, that I have a very competent team and we can change this around. And I've been assured by the President that I'll be given adequate amounts of resources to make sure that we do what is necessary to protect the Guyanese people. And that's what we are going to be doing. Right now, we have done some quick assessments, and the results of those assessments would be given to the President. And I'm hopeful that in a short while, he's going to talk about them and chart a way forward by setting out a number of measures which the government would take. So I'm very optimistic, and I think, with the kinds of cooperation and teamwork that we can do, we can bring this under control. It's a difficult thing. Every country has it. But I think once we take the precaution and we do the right things, we'll be able to do this. This here is not a Ministry of Health problem alone. For us to be protected from COVID, it would mean that the entire population have to come on board. That's how serious this is. There are too many people who are walking around and believe that, COVID is no big deal, right? Younger people feel that somehow it's not going to affect me, right? And some people have that kind of attitude. We have to change that, because you would have seen in one of the recent deaths, a 34-year-old person died. And so you have people at a younger age who are dying. And therefore, we all have to take precaution. But coming back to the approach, it's not only a health response, but it has to be a total country response. And we'll have to get other sectors involved, and everybody would have to take personal responsibility, right? So I think once we're able to do that and educate people, this thing is a lot about education, because without getting people to understand why they need to do this, then they're not going to comply. But if they understand why they're doing it, I think we'll get better compliance. So I think by bringing that kind of expertise on board, we'll quickly make a difference.